Hi everyone, it's Nishti here, specialist dietitian for children and parents, and today I'm going to explain to you the symptoms of cow's milk protein allergy. If you're unsure what cow's milk protein allergy is, and if you're unsure what type of cow's milk protein allergy your baby may have, then please refer to the links below. I've done a few YouTube videos on that topic. So in order to do this video, I have decided to share a few things with you. So let me just share my screen. And the first one I want to share with you is the NICE guidelines, which are a set of guidelines that we as healthcare professionals use to help us when we help patients. So the NICE guidelines show us the different types of allergy. So NICE guidelines can be for all sort of conditions. Obviously, I'm focusing on cow's milk protein allergy, and it focuses on signs and symptoms and also treatment and things like that. So I just want to show you here. And as I've discussed in another video, I've talked about the two types. So IgE mediated and non-IgE mediated cow's milk protein allergy. There are two types of allergy. And I'm going to focus today on the non-IgE because they tend to be the most common one that we see, or that I see as a dietitian. So let me just explain to you here. Now, I want to go through this list first here. So, reflux, loose or frequent stools, so diarrhea, blood and mucus in the stool, abdominal pain, and just children arching their back in pain, colic, food refusal, which could then result in poor growth. So down here, faltering growth, again, could be a sign of cow's milk protein allergy. Constipation, perianal redness means, red bum. It probably, sometimes the stools are a bit, or the poo can be a bit acidic, and that causes the red bum. Tiredness, and just a really unsettled baby. And then we've also got up here, atopic eczema, which personally, every time I have a baby with atopic eczema, I say, let's try a dairy-free. Let's see if this is cow's milk protein allergy. And I then do the diagnostic challenge that I use to diagnose cow's milk protein allergy. Not just I, but generally what we use as healthcare professionals. So just to show you here, I mean, the list, to be honest, is even longer than this. So that's why I'm going to show you another screen, which is this one here, which is Managing a Distressed Baby in the Community, a guide for GPs, which I produced with a GP just to help GPs around the country diagnose cow's milk protein allergy quicker, because at the moment it's just not done properly and it's taking too long, and despite all these guidelines, we're still not managing this patient group effectively. So I've done some guidelines, and I just want to show you this one page first. If you out there, healthcare professional, if you're a GP and you are keen to use these guidelines, please reach out to me, and I would love to come and even educate the practice, the GP, and whoever's watching this, because I'm on a mission to really bring more awareness around cow's milk protein allergy, so we don't have to see babies suffer for so long. So here we've got anxious mother and history of irritable baby. We put that as the number one, because I often find that mothers are not taken seriously. They're anxious, and they're anxious for a reason. There's something not right with the baby, but yet they've been told that, oh, it's just, here's some medication, it's fine, don't worry. Or colic, some Infocol drops, which by the way, don't treat the cause. So we need to really take mothers who are anxious seriously, because there is a reason for it. You can't just be anxious for no reason. And then we've put reflux, and just be aware, this is for non-IgE, right? So not for IgE mediated. Loose stools, vomiting, so basically, on diarrhea, arching their back, bloated or winded, constipation, itchy skin, atopic eczema, abdominal pain, colic, blood, mucus in the stools. And I'm just going to mention one that I haven't put on here, because the reason why we haven't put it on here is because the evidence is quite poor around it. And that is poor sleep. Now, I have seen that children who have an undiagnosed cow's milk protein allergy often don't sleep very well, because they're obviously not happy. And then as we go dairy-free, then they sleep better. And I've seen this time after time. So unexplained poor sleep. Why not think, oh, could it be a calcium and protein allergy? I'm not saying it always is, but who knows? Maybe it is. So the symptoms are numerous. And let me just share another screen. And again, you know, if you're out there and you know, you have any experience or any symptoms that you want to share with me, please feel free, comment below. So this share here, if it's coming up, well, I don't think it is. So new share, sorry about that. Yeah, I think you probably can see it, but I can't yet. So I hope you can see this page here, which is from one of my, it's a coursework that I do for my master's in pediatrics. And I'm just, again, comparing non-IgE and IgE, and there's nothing new here. It's the same thing, as you can see. But obviously, IgE is more associated with anaphylaxis, whereas non-IgE isn't. And you know, just be aware here, uncomfortable stools as well, right? And just generally uncomfortable. So this is very important for you to know as a parent, because if you know and if you empower yourself, then you could be involved in the whole management and the treatment of your child. That's why I do what I do. I feel that the more we know, the more empowered we feel, and the more we can be involved in the treatment of our health, in our children's health. So I hope this video has been useful. Please like or share this video, and why not subscribe to my channel? It would help me greatly, but I would love to hear from you. So it's Nishti here, dietitian, and I'll see you in the next video.